Talked about the skull and the facial bones, and today we're going to wrap up a few of these bones that are attached to the skull or very near to the skull. So this is your mandible. We used to call it the jawbone. Now that we're in anatomy, we call it the mandible. It is our only movable bone, which is pretty cool. There's a few things you need to know on your terms to know. The first is TMJ, which stands for temporal mandibular joint. The temporal bone, you'll recall, was, let's see if I can get you one here. This one, the red guy, is the temporal bone. And your mandible, this guy right here, attaches to your temporal bone. And so where the mandibular condyle attaches to the temporal bone, that's the TMJ. So mandibular condyle is another one on your terms to know list. And so is this fellow right here. This is called the coronoid process, another place for muscle attachment. There are a few other processes that you don't need to know for a test necessarily. The alveolar processes that hold the teeth in. The body of the mandible is just pretty much this whole arch of the mandible. There's also the ramus, which is this big portion right here that leads up to the coronoid process, the mandibular condyle. And then there's one more that you need to know. That's called the mental foramen. These are teeny tiny holes in the mandible for blood and nerves. I remember the name mental foramen by that statue that's called like the Thinker, and it has the guy with his hand resting on his chin and his elbow on his knee, and he's thinking, I'm sure, very deep thoughts. And I think about, his hand being on his chin as mental foramen being on your chin as well. So if that helps you, use it. If not, I'm sorry for wasting 10 seconds of your time. Next bone is a hyoid bone. It's a free floating bone. It's not attached to any other bones. We mentioned that, bones are sites for muscle attachment, and the hyoid is the site for your tongue to attach to. And so there's the hyoid bone right here, sitting on the trachea, and it says it's often missing because a lot of your skeletons in the lab won't have this because it's kind of hard to put a bone on a skeleton when you can't attach it to anything. So there you have that. Let's take a look at an infant skull. There's a little tiny baby head right here, and you can tell right away it looks very different from what you've seen before in this chapter. And let's talk about a few of those. Number one, fontanelles. When a new kiddo is born, we call them soft spots. There's an anterior fontanelle right up here. There's also a posterior fontanelle back here. And these are fibrous membranes where that bone has yet to grow in and close them completely in. And as a new baby grows, those fontanelles will get smaller and smaller until they're eventually gone. Little kiddos generally have a larger forehead and a smaller face compared with the adult skull, which is cool because it helps make them cute. They also have really relatively large orbits. The eyes on a little kiddo appear to be much bigger in proportion to an adult's eyes, and that's because your eyeballs themselves don't actually grow all that much throughout your lifespan. And so little kids look like they have really big eyes, which makes us think they're really cute, but also is going to be about the same sized eyes they have when they're an adult. And so it's just because they're smaller. A little bit smaller nasal cavity, small nose, little guys. A little bit smaller mandible. You can tell their jawbone's super small. And then some incomplete sinuses that are still forming on this new kiddo. And so here's a picture of the top of the infant skull. And this is the anterior side and the posterior side. And so the anterior fontanelle, you'll note that the frontal bones actually started as two separate bones. And where the frontal bones have yet to merge and the parietal bones have yet to merge, we get this big soft spot called an anterior fontanelle. And it's one of the reasons that we have to be kind of careful with the little ones. You don't want to hit them on the head because underneath of that soft fibrous membrane is their brain. And so don't drop your babies. Then here's posterior fontanelle, which is the same thing, a little soft spot. And then this guy will come on eventually to be the sagittal suture, Right now it's just a big membrane, so that's kind of a cool deal. Infant skulls, they're adorable. Alright, so what's gonna be on your skeletal quiz? This guy, and this guy, and this guy, and this guy, and this guy. Secret's out, okay? I might pull some of these diagrams from those labeling exercises I had you do online instead of these pictures. I'll do my best to get them in color, no promises there. And I can spend a lot of class time quizzing you guys over these structures. So I mean, there you go. That's what your skeletal quiz is going to be like. The skull quiz at any rate. So let's move on. We've spent a lot of time on the skull because it deserves a lot of time. But let's talk about our vertebral column. Location of your vertebral column from the head all the way down to the pelvis. This orange line is the vertebral column. The structures that are going to build it up are going to be our vertebrae. And these guys support our head and trunk, of course. And they also perform a very important job of protecting our spinal cord. There's intervertebral discs, which we've talked about already when we talked about our types of cartilage, but they're going to cushion our spine, they're going to cushion our movements, and they're also going to maintain these very important structures called intervertebral foramen, which means the holes or windows between the vertebrae. And I'll show you why those are so important in just a minute. And so I'm pretty sure you guys have a worksheet over this in your packet. You should. This is the spine, and here's what you need to know about it. The whole thing. Cervical vertebrae are your neck. Your neck has 7 vertebrae. Okay, this is going to end just below about the collar of a t-shirt would be about right here. Your thoracic vertebrae, there's going to be 12 right here. Your lumbar vertebrae, there's going to be 5 right here. And then your sacrum, these fused bones right here. And then your teeny tiny human tail that's just hardly anything. We call your tailbone, but now that we're in anatomy, we call it the coccyx. So, what you need to know about these is the names and the numbers. 7, 12, 5. Okay? The numbers 7, 12, 5. Start in the middle. You go up to 12. You drop down to the lowest number of 5. That can help, I guess. The other thing you're going to need to know is the names of the curvatures, which are very easy. Your spine is not a straight line. This is looking at the posterior side, the back of the spine. And assuming you don't have some sort of injury or scoliosis or something like that, it's going to look mostly straight. When you look at the side view of it, however, even though your head and your legs are straight up and down from one another, the spine that makes it up is not. It's very curved. We have a cervical curvature, we have a thoracic curvature, a lumbar curvature, and then at the very end, a pelvic curvature. So we're actually like a big, I don't know, S or something when you look at us laterally, which is kind of a cool deal. I remember the name lumbar. Maybe it's not hard for you to remember, but if you drive a nicer vehicle, some of these vehicles will have like lumbar support, and it's a little button or dial you can turn that will push your car seat out into your lower back. So that kind of helps, I guess. Here's those intervertebral foramina we talked about that our intervertebral discs maintain. They maintain the spacing here, and that's going to allow nerves, because our spinal cord carries a lot of information, and that information has to get out of the spinal cord, and it's going to leave in nerves that find their way out between the intervertebral foramina and then run all over our body. So that's kind of a cool deal. There's your curvatures. Got it. So here's one. It's a little zoomed in and pixelated, but this one, C7, has its own name. So does C1 and C2. But C7 is called vertebra prominens. So let's take a look at this one. Right here. Vertebra prominens, C7. 1, 2, 3, 4, 5, 6, 7. It's that easy. And then for numbering thoracic vertebrae, T1, T2, T3, T4, T5, T6. It's that easy. So that's nice. So vertebra prominens is called the prominent vertebrae because it's very, very easy to feel. And you can look at the size of these processes that hang off the back of the vertebrae. And if you tilt your head forward, like you're trying to touch your chin to your sternum, you can feel this huge bump on the back of your neck. If you start at the top of your neck and run your fingers down your own neck, you can feel this huge bump. It's the first vertebrae that you can feel, and that is because of the very large spinous process of C7, vertebra prominens. So that's kind of a cool deal. He gets his own name. Okay, got it. So let's take a look at a typical vertebra. We just pulled this vertebra out of somewhere, and we've got to name these pieces, because this is anatomy and we name everything, right? So this big circle that makes up the probably the largest portion of the vertebra is called the body. Okay, it's going to provide strength. It's going to support your weight. This guy that sticks out to the side has the very logical name of the transverse process, or the process that sticks out to the side. We normally are going to attach ligaments to this to support our spine. Now this little piece right here that connects this whole archway to the body is called the pedicle. Okay? Pedicle is from this Latin root for little foot, and so it's this little foot-like structure that attaches the whole arch to the body. Then we have a spinous process, which again is for ligament attachment. Now this part here, between transverse and spinous, is called the lamina. Okay, so the pedicle is between the body and the transverse process. The lamina is between the transverse and spinous process. So it goes pedicle, lamina, lamina, pedicle, arch. Isn't that ridiculous? Anyways, the vertebral arch. That is this whole thing we're describing right here. Spinous process, lamina, pedicle, transverse process, that kind of stuff. And then we're going to have, in this one, they're very obvious, but we're going to have a superior articulating process, which is, let's get a pen here, this guy right here. Superior articulating process is how we're going to connect this vertebra with the vertebra above it. It's going to sit on the superior articulating process. And on the vertebrae above it, it'll be called the inferior articulating process. And so we have these little knobs that stick out that attach us to the vertebrae above us and the vertebrae below us. And they are cartilage-covered facets that form the joints in our spine, so that our spine can move and flex a little bit. And then finally we have the vertebral foramen. Foramen means hole, so it's right here in the middle. And there's several of them, about 25, and they all line up, and guess what runs through there? If you said a spinal cord, you are correct. And everyone in the room is looking at you because you're talking to yourself. So, that's okay, because you got it right. That's what matters, right? So typical vertebra, here they are all stacked up to make your vertebral column. Your superior articulating process right here is articulating with the inferior articulating process here of the vertebrae above it. And these guys are forming the joints. This picture here, they've added the intervertebral discs and then a spinal nerve running out of those foramen. So that's kind of cool. Got it. Alright, so let's name a couple of these. A couple of our vertebrae are so important they get their own names. We've already learned the vertebra prominens for C7. Out of the 7 cervical vertebrae, the couple that we spend the most attention to are named atlas and axis. Atlas is the first cervical vertebrae. You want to take a guess as to why we named it Atlas? If you know anything about mythology, which I don't, Atlas is apparently this very strong guy who holds up the world. And he has these cool pictures of Atlas as this guy who's sort of bending over with his arms behind his back, supporting our whole planet. And Atlas is our first cervical vertebrae, and it supports this big round thing we call our head. It's responsible for the yes movement in our skull. If you want to nod your head yes, you are literally rocking your skull back and forth along Atlas, which is kind of cool. It has these little articulating facets on the top that are kidney-shaped. Sure. And they articulate with our occipital condyles, which you'll recall from the skull. And so it also has a little facet up here that articulates with the dens, which is going to make more sense here in about a minute. But you'll notice that Atlas has no body, which is crazy. It's a vertebrae with like no body. And so there you have it. It does have a huge vertebral foramen, which I mean makes a lot of sense because we're going to have a big old brain stem and spinal cord coming down into it. It does have transverse foramen, which is very cool, and you're only going to see that in a few of our vertebrae. It has a little tiny transverse process, nothing too terribly significant, and that's what Atlas looks like. So then here's our second one. The second C2 gets its own name, and it's called the axis. It's our second cervical vertebrae. And its most unique structure is right here. It's this little thing that looks like it's giving you a thumbs up. That's called the dens. Okay, this is a lateral view. This is a superior view. The dens, or the odontoid process, if you want to be really nerdy about it, it's going to allow us to pivot and turn our head. And so axis can kind of rotate around this, and we can shake our head no. And so that's kind of a cool thing. It has a bifid spinous process. So its spinous process breaks into two, like a little tail fin, perhaps. We still get some transverse processes. We still have little transverse foramina. They're not huge, but they're there. We have our superior articulating facets to support Atlas, because we know that Atlas had no body, and so we had to give it a pretty decent sized superior articulating facet to hold all of that weight. And that's what axis looks like. So kind of an important vertebrae to know. And so then here, whenever you see cervical vertebrae, here's what you're going to see. You're going to see generally a body. This is C3 through C7. You're going to see superior articulating facets. You're going to see transverse foramina. You're going to see transverse processes. And you're going to see a bifid spinous process. And so there may very well come a day where I'm going to show you a couple of vertebrae, and based only on what they look like, I'm going to say, where do you think it came from? And you should be able to make a pretty good guess. If you see a bifid spinous process, it's probably a cervical vertebrae. If you see transverse foramina, it's probably a cervical vertebrae. Quick question for you. Let me show you a thoracic vertebrae. This is a thoracic vertebrae. Now you notice we lost those transverse processes. So, we lost those transverse foramina. Why do you think that is? Why do you think all the vertebrae in your neck have two holes, one on the left and one on the right, that are completely encased in bone? What do you think they're protecting? What's something important that runs up your neck that we could potentially put through the transverse foramina? If you're thinking maybe like arteries and veins that lead to my brain, you are going to be correct. So let's stop there. I don't want this video to run too long. We'll come back and we will look at thoracic vertebrae next time. So thanks for your time.